In our center, we started our experience with Carbomedics in 1988. So that gives us right now an experience of above 20 years of using the product and as well following those products. We have been very interested in learning and following patients with mechanical heart valve prosthesis. I've been myself implanting Carbomedics valves since 2000, the year I entered and practiced here at the Montreal Heart Institute. The first point that you want to be considered a valve is to know, is it a valve which is going to be durable? Because you're going to need to have anticoagulation, and the biological valves are better and better. So you want to have a product, if possible, which is free from mechanical failure. And this is one of the most important point about Carbomedics prosthesis is it has never been reported that there was any valve failure using this product. Then, looking at data of thrombogenicity, of thromboembolic event, of bleeding, it has a very, very favorable results in terms of very low event per patient year during the follow-up. Especially, I believe, from what I have analyzed of the current literature, the thromboembolic event on the mechanical aortic prosthesis is the lowest of all the industry put together. The other interesting part of using the Carbomedics, on the aortic part, they have a model called the top hat, which is a model built to be positioned on top of the aortic annulus. And that position helped putting a very efficient valve with a valve orifice area probably 2 sizes up compared to what you would need to sew in a smaller aortic annulus. On the mitral valve position, was very interested into the Sorin Carbomedic line is the Optiform valve, which got such a huge sewing cuff around the valve, which makes it a very, very versatile product to use in endocarditis, to use in heavily calcified valve, to use with preserving the subvalvular apparatus and wanting to be far away into the left atrium, or to use for double valve mitral and aortic replacement.
I've been following patients that have underwent surgery with a Carbomedic valve for more than 30 years. I've been following them just for the last 5 years since I've been here at the Montreal Institute. But I would say that I have patients that underwent the surgery for more than 30 years. They have done very well. We don't see major complications related particularly to the hemodynamic profile of the prosthesis over long term.
The supraannular design, especially the model I know the best, which is the top hat, allowed patients with small aortic annulus to have a valve which is 2 sizes higher than the regular prosthesis we would normally put in. So patients with small aortic annulus, patient requiring double heart valve replacement, mitral and aortic. So normally you would have competition for the fibrous junction between the aortic valve and the mitral valve. So if you put a mitral valve prosthesis, it becomes more cramped, and the supraannular valve is a very valuable product in that situation. The other indication would be a very calcified aortic annulus, where you want to be setting the valve above all that calcium. And any patients, especially more frail patients, where you want to avoid to to have annular enlargement to have a properly sized aortic prosthesis. You need to be cautious about the coronary ostia. You need to be certain that you're not going to have a valve sitting too close to the coronary ostium. If they're low sitting or if the aortic root is narrow, you should be careful about those patients. You should be careful not to have too much of the annulus protruding underneath the valve. So the way you place the sutures, you should have some technique like interrupted stitches where you would pull away the aortic annulus to have the full opening of the supraannular valve available for blood passage.